All right, so today I'm going to be talking about Patient Education Genius, and this is a product of ours that was recently validated by Cerner, and it will shortly be listed in their app gallery. Our company's CEO, our company is called CoherentRx. I'm the product director of CoherentRx. Our CEO, Tom, is over there. He's the one that made me drink the hurricanes. We are healthcare outsiders. We have no formal medical or healthcare IT training. We actually come from the entertainment industry. So almost out of necessity, we've kept our goals simple, but definitely ambitious. In this presentation, I'm going to discuss some of those goals, and I'm going to comment on how FHIR has helped us pursue them. So let's see if I can get to our next slide. Oh, page down, right? All right. So just to say a word about CoherentRx, we built apps for medical education for several years, and we only recently turned our attention to the challenges that providers face in delivering education to their patients in a clinical setting. The theory that led to the creation of Patient Education Genius is very simple. If patient education is easier for providers to deliver to their patients, more patients will receive more education on a wider variety of healthcare topics. Adherence rates would increase and health outcomes would improve. Simple hypothesis. With this hypothesis guiding our development, we began creating Patient Education Genius. Patient education is an industry that's been dominated by companies that in many cases have been around for 50 years or more. And like it or not, they're really paper-first companies, and their focus is really in creating content. We saw an opportunity for a different approach. Marrying our background in entertainment with our years working with healthcare providers, we formulated a simple concept, which is Spotify for patient education. And that's what Patient Education Genius is. That's what we set about building. Rather than creating patient education content, we built a platform that aggregates all of the world's best patient education materials. Just as Spotify allows music lovers to access all of the world's music in a single location, Patient Education Genius gives healthcare providers a single destination to find all of the patient education materials that best address the needs of their patients. The curated library of materials is, we believe it's the largest in the world. It's over 50,000 titles created by over 250 different sources, leaders from medical associations like American Lung Association, American Thoracic Society, to the CDC, and even some of those patient education incumbents like HealthWise, who we work with, and some newer companies that make really cool patient education content. Additionally, providers can upload their own materials just like they would on Dropbox. All of this can be delivered to patients via email or text message. And later in this presentation, I'll show you some visuals of that. Unlike many current solutions, patients are not required to create an account or download anything before viewing their health information. It's frictionless. And unlike pamphlets or printouts, Patient Education Genius allows patients to share their health education with their family and with their caregivers. Difficult for my dad, who just had bypass surgery, to share his education with me. I live in California, he lives in Connecticut. And because these materials are easily accessible via their smartphone, they can access their education anywhere, whether it's a patient sitting in the hospital bed, me sitting on my couch wondering how my dad's doing, or somebody waiting in line for coffee, anxious about an upcoming procedure. Like many of the companies that dominate entertainment industry today, from Spotify to Netflix, Patient Education Genius, we've taken a data-driven approach. Beyond helping us make development decisions, the data that Patient Education Genius generates has a range of use cases. At the provider level, via the Patient Education Genius dashboard, healthcare providers are able to see if patients have opened their materials that were sent to them. Again, I'll show you a visual of that shortly. This sort of information can spur clinical interventions and also support decision making. At the health system level, Patient Education Genius was built with value-based care in mind, and we are able to provide some rare insight into the conversations that are happening between providers and their patients across an entire health system. Beyond that, helping to improve treatment adherence and health conscious behavior, documenting these conversations is critical for meeting the various quality mandates like MIPS that are tied to payment incentives. So just a word more on this. Our approach to this, we were very inspired by this 2014 study. It was on the impact of electronic monitoring on hand hygiene. Like patient education, hand washing can be viewed as sort of a should do rather than a must do. With record high patient loads and an unfortunate amount of time eaten up by administrative paperwork, should do's oftentimes receive less attention than they should. As you can see here, when the study began, the participants were washing their hands at about 32% as often as they should have been. When participants were asked to wear an RFID lanyard that tracked each visit to a hand sanitizer dispenser, their behaviors changed dramatically. Hand washing compliance increased to 85 and sometimes 100%. Similarly, by tracking providers' patient education efforts, Patient Education Genius is able to provide a feedback loop that reminds providers to prioritize patient education among their many other priorities and tasks. As a start, as you can see here, each week we email our users a wrap-up of their patient education activities. We also have passive alerts that notify providers when a patient opens something that they sent. The idea here is not so much to enforce or coerce compliance with patient education mandates, but more to remind providers that the time and energy that they're taking walking their patients through a concept is actually time worth taking. It's worth dedicating that time. Handing a patient a pamphlet, you have no idea what they do with it after they leave the consultation room. And that can seem like a waste. If there are any Spotify users in the audience, you might have gotten a similar sort of feedback loop this week. At the end of the year, they're trying to promote usage of their platform by providing kind of stats, usage stats, just like the usage stats. Okay, a little different than the usage stats that we provide to our providers about their patient education behavior. There's more Bruce Springsteen in their stats than in our stats. But this sort of feedback, spurs me to be a better listener. Our feedback spurring providers to be better educators. Okay, so let's see. So I want to keep talking about the data that Patient Education Genius generates, but I certainly want to talk a little bit about FHIR. As I said at the beginning of this presentation, our hypothesis is that by making patient education easier for providers, patient health outcomes will improve. Okay, so what's easier mean? And in our eyes, easier means streamlining the delivery of education, aligning education efforts with various payment incentives, and also at the same time reducing the administrative burden that is involved in documenting those efforts. So I'm going to quickly now walk through our integration, our Cerner power chart integration that uses FHIR leverages FHIR to connect to the patient record. There we are. So here we have Nancy Smart's patient record and power chart, who has a bypass surgery coming up. In just one click, the provider is able to launch Patient Education Genius from Nancy's record. There, he sees a customized dashboard with folders containing materials that he uses with his patients most often. As you can see, our interface it's really designed to be very familiar. It's modeled after iTunes and Spotify. The goal with that is just minimizing the amount of training and onboarding that's required before go live. Finding relevant patient education materials can be difficult and it can be time consuming. With Patient Education Genius, providers can locate materials very quickly with a predictive search. They can add them to their favorites folders and they can access them later. As I mentioned earlier, unlike most patient education solutions, Patient Education Genius allows you to upload and send whatever you want. Discharge instructions, surveys, fact sheets, and anything else that providers are accustomed to printing and handing to their patients. Now that we're validated, we're working on our next iteration of this feature, which is leveraging FHIR will pull in data from the patient record that allows us to suggest education that's relevant to the patient, and that's really just the start. So with the Genius, providers can deliver education to their patients in seconds. As I mentioned, the patients receive the content via text message or email. No password or download is required for them to view those materials. Here is our tracking dashboard. So by automatically tracking the materials that were sent to every patient and documenting whether those materials were opened or not, Patient Education Genius allows providers to monitor their patients' engagement in their care and follow-up. If they haven't opened their materials, of course, reminders are sent to the patient to make sure that they do. So leveraging FHIR, the FHIR API, a record of all the education that was delivered using Patient Education Genius is documented back to the patient record. And cumulatively, this creates a longitudinal health education history for the patient. Our belief is that this sort of data and all the associated data, all the data associated with patient behaviors related to their education benefits every stage of the healthcare value chain, from improving clinical decision making to streamlining claims processing and mitigating risk. Providers are able to demonstrate their compliance with MIPS and other incentive programs without creating any additional documentation. For payers too, this data has a range of different uses, from facilitating member engagement to creating risk profiles based on patients' adherence to their education. As an interface that sits between providers and payers, Patient Education Genius seeks to kill two birds with one stone. By automating the collection of data about patient education, we're able to reduce the administrative burden that providers face while also delivering more robust data back to payers. I have no idea where I am time-wise. Has it been? Oh, 1 minute remaining. Perfect, because this is my last slide. As I said earlier, our first FHIR-based integration was just validated a few weeks ago. We've only just begun to explore what we're able to do with FHIR. But to zoom out for a moment, I just want to end by commenting on what FHIR has allowed us to do as a company. CoherentRx is a small, privately held company, and to a very real degree, the existence of FHIR is material to our success. By allowing us to scale Patient Education Genius, we're able to compete with patient education companies that have been around for decades. Last month in October, we were at Cerner's Health Conference, and we were giving presentations next to Crames and HealthWise, and we now work with HealthWise. They've been around for over 50 years, and that's really extraordinary, and FHIR is what enabled us to get there. We're really excited about all the possibilities that FHIR presents and the disruption that it could cause, honestly. So before I start sounding too much like a keynote speaker, I am going to stop there. Thank you.